Hi, everybody. My name is Brooke Smith. I'm the CEO at United Way of Lebanon County, and happy to be here to do another edition of our COVID-19 Community Connection series. And today I have two lovely ladies with me that are going to share some insight about how COVID-19 has affected the childcare industry, not just here in PA, but really across the country in response to this pandemic. And so I want to just take a minute and allow them both to introduce themselves and share about their organization and the work they do. So if you want to start, Maggie.
Hi, everyone. I'm Maggie Livelsberger and Director of Public Policy for United Way of Pennsylvania. And we are really tasked with being the statewide organization to bring together all local United Ways and advocate at a statewide level on behalf of policies important to them and our communities.
Great, thanks. And how about you, Kelly?
My name is Kelly Benasutti, and I'm from the Lebanon Valley Family YMCA, and I'm the Director of Childcare Services there. And so we operate two childcare centers along with about 15 SAC before and after school sites, as well as 7 summer camps. So We've been kind of trying to stay on top of it.
I bet you have. Awesome. Well, thank you both for being here today. I also want to share with those of you who are viewing live, if you have questions for either of our guests today or for myself, you're welcome to put them in the chat box, and hopefully we can get to them today. If not, we can certainly get back to you with an answer. So we'll go ahead and get started with a couple of questions. Maggie, we're going to get started with you. I know that the work that you do allows you to kind of remain pretty close to what's happening at the state level as far as how COVID has affected the childcare system. And, I'd love just to hear kind of some of your thoughts and experiences and knowledge on that.
Yeah, so I think COVID has had a real detrimental effect on the childcare system in general. I was actually just reading an article this morning that talked about how much of a foundation childcare is for our economy. And whenever childcare centers shut down on March 16th, it really kind of put a wrench in a lot of families who were still going to work and needed that care. About 80% of the childcare providers in Pennsylvania have closed their doors. There was some waivers allowed for certain family care centers, group care centers, and then child care centers that were providing services for essential workers to stay open. So roughly about 1,500 child care centers still remain open. But the child care providers are laying off their employees. They are furloughing employees. And they are really concerned that if we don't have any more funding for this, or we don't open up soon, that there's going to be a real ripple effect to their business plan and even being able to open their doors again.
Yeah, that's consistent with what I'm hearing from providers across our county, at least. What type, if any, of relief efforts are being provided through the CARES Act from either the federal or from our state of Pennsylvania to help?
Yeah, so I will start with the federal government first. So they passed several stimulus bills right now, and a couple of them have called out childcare specifically. The CARES Act actually put $3.5 billion in there for childcare system, and that would be through the Childcare Development Block Grant. There was also an additional $750 million for Head Start to really deal with their emergency staffing needs. And so that trickled down to Pennsylvania, and we got roughly $106 million for that. We have received that funding. However, we're still in negotiations about how that funding will be spent. And that is really between our Office of Child Development and Early Learning, the legislature, and of course, the Wolf administration on how those funds will be drawn down. Yeah. There's also been some relief for employers themselves. So the CARES Act also provided the Small Business Administration with funding for an economic injury disaster loan, as well as the Paycheck Protection Program. And I do know that a few childcare centers in Pennsylvania have applied for that, as well as a lot of the nonprofit centers who may be running childcare out of that as well. And that funding is really to help cover payroll and expenses for a few months. It's a low interest loan, and most of that loan is going to be forgiven entirely.
Yeah. Are there any other advocacy efforts that you're spearheading or a part of at either the state or the federal level to continue to advocate on behalf of the childcare industry?
Absolutely. So we are principal partners, United Way of Pennsylvania. It's been principal partners of Start Strong PA. and pre-K for PA. So those campaigns are working heavily across the state and with our legislature to ensure childcare centers are taken care of. So we are working on various stimulus asks for how that money should be spent. Of course, we want to see a rapid reopening of childcare centers, but we also want to make sure, that whenever they do open, they have all the necessary precautions in place to be able to serve families and children. So included in some of that ask is money for training, money for equipment for masks and other cleaning supplies. Certainly, we are looking at extending the co-payments that have been lost through Childcare Works program, that is the subsidy program, as well as all the tuition that's been lost from private pay families who are no longer paying. So we're looking at a lot of those issues as well. We also want to make sure that we have access to Head Start and pre-K count summer instruction, because we know that we need to continue to have education throughout the summer to avoid the summer slide. So that's something that we've really been looking at as well. And really just making sure that we're protecting our childcare providers from any liability that they may be experiencing or any claims against them related to them being open during a pandemic and thereafter.
Yeah. Go ahead.
We're also looking at an essential worker voucher. That would essentially provide a tax voucher for essential workers who have had to pay out of pocket for high quality childcare. And so that's something that we have been working on with the legislature, and we're hopeful that that is something that will be able to go through with legislation.
Yeah.
At the federal level, we advocated for an additional $50 billion in the next stimulus package that comes through. CARES Act 2, I will call it, came down, and that was more for hospitals and healthcare workers, as well as additional money to the SBA for that paycheck protection program. So we are anticipating another stimulus bill to come through, and we're hoping that that's going to be a more catch-all where we can include some of those asks for that $50 billion for the childcare system.
Yeah. I feel like this is an industry that has been struggling to kind of gain support, and slowly we've seen the funding come through over time to support childcare and early learning. I think, if anything, in my opinion, this has really brought to light the importance that childcare plays in our economic stability as a country, as a state. It's really brought to light if folks don't have quality places to take care of their children, they can't go to work. So I think it's brought some of that to light. Thanks, Maggie, for sharing some of that. I'd like to kind of move to Kelly a little bit to hear about, like Kelly shared, the YMCA is our largest childcare provider in Lebanon County. And I'd love to hear from your perspective, kind of how this has affected your business model, your families, your children.
Well, it's affected our business model greatly. We do serve over 300 children in our county alone. And so now we've kind of taken a step back, and we've put everyone's tuition on hold. The instant that we had closed down, that's what had happened. But we have continued to pay our staff, and we recognize the importance of staff and teaching them the opportunity, or giving them the opportunity rather, to really professionally develop. We are required to meet different STARS trainings and different, Department of Human Service trainings. And so we've taken this opportunity to allow them to do that. It has kind of put everything on hold, though, in terms of, we don't know the unknown, and we're really struggling to sometimes answer questions that they might have. And so what we've been doing is really communicating with statewide YMCAs, just to kind of see what they're doing, and really trying to envelope and compact how we're going to move forward and how we're going to move forward safely. Mm-hmm. And so some of the things that we have really done, we've created a draft of, or guidelines, if you will, on how we're actually going to open our facilities and how we're going to do it in a safe manner. At the end of the day, the safety of everyone is really our priority. Now, we recognize as a YMCA too that there are the yellow and the green phases. And so the green phase is kind of the fitness aspect. And so our learning curve will really be in the childcare phase, and just really getting everybody to hopefully be really safe, and we hit it off the ground running to do so. I know that there will probably be ups and downs with staff, potential illnesses or the concern of illness. And so we're looking to really accommodate just how we're going to be doing that with everybody.
Yeah. Have you been able to maintain any contact with your families? I know that you have early Head Start slots in some of your centers and pre-K counts. How have you maintained, if any, contact with the families and children?
So to break it down a little bit, so our child care centers, having contact with infants is a little challenging. But what we've done is we've created Google Classrooms. We have a Seesaw app, and we do Zoom meetings. And so the classes specifically are before and after school care. We have these Zoom meetings, and they get on and they're like, I haven't seen you in forever. And so we're really trying to keep in close communication with them. We send them, sometimes we're providing a list of meals where they can go in the county and get and obtain the meals that they need. And now with the way the food program is running, you're allowed to take multiple meals at a time, whereas before you weren't allowed to do that. And so we try to keep them up on just countywide opportunities that if they are struggling in need, they can do that. And then in turn, we also do different things. So Mother's Day is coming up. And so we're doing a virtual Mother's Day bingo themed application with the kids and the moms. We've had great success with the Seesaw app and sending out different story reading times. And so we've really worked hard to make sure that relationship and the welfare of their child is still moving forward as best as we can virtually.
Yeah, that's really great to hear. I think a lot of providers have been doing the same. I think it's so important just to mention that the bond and the relationship between the caregivers and teachers and the children is so strong. And, just like our public school system, it was kind of abruptly ended. And, that's a really important person in the lives of these children. So I think that's really great that you're maintaining that contact. Has there been I know there was some discussion at the state level to maintain payment to facilities that serve children that had subsidized childcare through the ERLC. Have those payments and subsidies still been being pushed forth to the providers themselves?
Yes. Right now, I think the latest I've received, the information was we would have it continued through until May, and so we are getting those subsidized payments. So that is good. I also know just a meeting I had earlier this week, we had talked about our before and after school programs. We are for summer camps. We are housed in school locations, right. And it's a great unknown. Are we going to be allowed to get back into the schools? And so the YMCA statewide alliance is pushing forth to see if there's a way that we can really get into, necessarily not an unlicensed facility to ensure. So we're kind of waiting on those results to come back and see what that waiver might state. But that looks to be potentially our next option, depending on how everything is moving forward.
Yeah. What are your biggest concerns, Kelly, I guess, in thinking about reopening and moving forward?
So utmost is safety and ensuring that every child that enters our facility is safe and every staff member is safe. That is probably the highest one. I want to make sure that we are offering the same quality care, but realizing like we're going to have to take away the fabric-based toys or costumes, and how can we do that moving forward to create progression in their lives as they continue to move. There's been a gap so far, and so how can we close that gap and continue to give them a well-rounded education, knowing that we're not going to be able to maybe do some of the things, touching Play-Doh, the different importances, I think, of the different types of toys that they are touching or interacting with. And so we really, it comes down to looking at the procedures we're going to put forth that will be conducive to everybody, and just making sure we have the supplies on hand. That would probably be my second one is masks, gloves, sanitizers, because I feel like the turnaround is going to be huge, and keeping the cleanliness of the facilities.
Yeah, absolutely. Maggie, I know that United Way of Pennsylvania put forth a project called Alice, And I was wondering if you would maybe talk to the audience a little bit of just a snippet about what Alice is and how childcare and this pandemic has affected Alice in this way.
Sure. So stands for Asset Limited Income Constrained Employed. And basically, ALICE are the 1.2 million households in Pennsylvania who are going to work each day but still struggling. Oftentimes, we talk about ALICE as living paycheck to paycheck. And so childcare is a very essential part of Alice's lives. They rely on childcare to go to work every day. Oftentimes, they don't qualify for a subsidy in childcare, so they're paying that private pay tuition, which is expensive. On average in Pennsylvania, from our Alice data, it's about $1,400 for a high quality center, and that's per month for a preschool age child and an infant. And so that's a substantial portion of an Alice's budget. In fact, childcare accounts for nearly 25% of a family of four's budget. It's one of the greatest expenses for them. So if they don't have access to childcare, they're not able to go to work, which means they're also hurting their financial stability bottom line. Further, if Alice is in these essential worker positions, which many of them are, they are still going to work. So childcare being closed throws a wrench into their daily routine. They either have to find a childcare center that is open or they have to find alternative care, which then again can put risk to their family and their children's health if they are exposed to COVID-19 or any other illnesses. So, some private pay families are still paying, although I think that has dwindled quite drastically in Pennsylvania if it's being done at all. But if they're paying for care and they're not utilizing the space, then again, that's $1,400 or whatever it might be out of somebody's monthly budget.
Sure. Kelly, have you heard any stories kind of anecdotally from any of your families that have really struggled because of childcare being closed that still had to go to work? Like anything?
Most of the directors, we talk weekly, and most of them have had positive things to say. Now, I know that some of the grandparents are watching their grandchildren when the parents go. We had applied for an emergency waiver for all of those essential workers that were at WellSpan and things. And there's been some changes, though, going through as I've talked to the Department of Human Services. And so it would if you weren't utilizing, it was canceled. And so it's just a big learning curve of how everything is in operation. Other than that, we've heard, that they miss us or, they can't wait to get back in the classroom for one reason or another, but we haven't heard of anything that has been detrimental. And so that is really good to hear.
Yeah, absolutely. Has there been any guidance set forth from the Department of Human Services about reducing, class ratios and, smaller group sizes? Has there been anything put out to you about how to reopen and any more stringent guidelines that you're going to be required to follow?
Everything that I have come across has been through the CDC. Now, there will be, I do believe that Ochdale is coming out with some different steps moving forward of what's going to have to happen. So we are, I'm looking at our classroom size, square footage, and we're going to have to, practice the social distancing and keep it up at 6 feet. For our childcare centers, we have nap times. And so those nap times, the cots are head to toe versus, maybe a head to head or 3 feet apart. And so we're really looking at those different avenues. How are we going to fit everybody in there? Is there going to have to be some changes that are going to take place? And so that is something we have started looking at and figuring out the ratios for each of the classrooms and what's going to be appropriate. I'm sure there will be definite changes coming from Ochdale that will be saying like, okay, you can have this many kids, the ratio is going to drop, where the potential turnaround could be a much a heavier staffing requirement than on our need as well.
Yeah, and for anybody that has ever had any foot in the door in the childcare industry, that they're not operating on huge profit lines here. And so, I think my concern also is, although, of course, the safety of the children is of the utmost importance and your team, what is that going to do to the bottom line if now, you can't have the revenue of the maximum children that you've had in the past because you need to practice the proper social distancing and abide by the guidelines. How is that going to affect the financial stability of the providers? I think that's a concern for me. Is that anything that you've talked about?
It is. We're still trying to play it day by day, really, on what is the next step in all of this. And on May 11th, they intend to open up some parts of the state. Well, May 8th, but Monday is May 11th, and so looking at what are those guidelines going to be set forth. And so we're hoping in the next week or so that Octal and they're going to have this together, and then we'll start to create a more firmer plan. But really, there's just so many unknowns. My staff ask me questions all the time, and I say, my guess is as good as yours. I try to give them some kind of answer, but I don't want to give them false information either. So,
of course,
clear communication.
I appreciate that. So Maggie, what do you think is next kind of at the state level, or if people want to get behind efforts for advocacy, what can we do?
Yeah, so I think that the most important thing that you can do is contact your elected official and talk to them about why childcare is so vital to your household or to your business model. I think that that's the most important thing that you can do, is just staying in contact with your local officials. We also have United Way of Pennsylvania, along with the Start Strong PA and Pre-K for PA campaigns, have calls to action where you can actually sign on to a letter or send an email to your local officials, just talking about the needs there. I would recommend that as well. The negotiations are starting, and they're happening right this second. In fact, the Senate Democrats yesterday unveiled a plan where they are hoping to spend down the roughly $4 billion stimulus dollars, and there was about 150 million carved out for childcare initiatives. So certainly being in touch with your local officials to talk about what that would mean and where that funding should be spent. Certainly, obviously, participating in any type of activity that your providers are doing in your area. Like yesterday, United Way of Pennsylvania did a Twitter chat, and we invited providers and parents to speak on Twitter about some of their challenges. So that's a really great way that they can lift up kind of the struggles and make them more apparent.
Yeah, I know our local Chamber of Commerce is also pulling together a peer group next week. You can find information on their website if there are other providers watching from Lebanon County, just to kind of share some ideas, thoughts as you're all working through reopening and the challenges that come along with navigating that. So that's a resource as well. Our United Way is also connected to Maggie and her team as far as advocacy efforts, and we have been involved with some of that as well. Anything from either of you that you want to share or make sure that kind of those watching are aware of in this space?
I think that maybe one of the things I'll reiterate again is that before COVID-19 hit, we didn't really understand how fundamental childcare was to our economy and to our workforce. Of families that have children, nearly 70% have all available adults in the workforce. And so without childcare availability, our workforce is going to be decreased. Businesses are going to suffer with turnover rates and training rates. And really, children who do not have the opportunity to get into a high quality center or to have high quality learning are going to suffer. And they're going to suffer the most because they're the ones that need to prepare and get ready for kindergarten and their K through 12 schooling and beyond. And we know that in the first 3 to 5 years of life is when the brain is active the most. So providing them that opportunity to have that engagement. I was just on a call with several legislators this week, and I said, childcare providers need childcare educators. They need to be the richest people in our societies because I cannot do what they do. And I think talking with a lot of my parent friends, they are all in the same boat. It's that how do they do this all day? And it's been a real challenge. So I think that we have to start thinking about families. We have to think about providers, and we have to make sure that they're able to open their doors. Pennsylvania did a study or a survey in March, and from results of that survey, potentially a third of our childcare providers may not open due to COVID. And in a state where we already have a vast amount of childcare deserts, that puts a huge strain on the economy and on the industry itself.
Yeah.
So I would just echo getting in touch with your elected officials, being vocal about the needs and why it's so important to have childcare for your household, for your children, for your workforce, and really just kind of echoing and making sure that that is something that is addressed in the stimulus funding and beyond.
Great. Thanks, Maggie. Anything from your perspective, Kelly?
Um, I just, I know there's parents out there that are becoming the stay-at-home teacher as well as managing their own jobs. And we totally understand. And we just want to see your kids again. And we want to be able to help them flourish and develop. And, hopefully it'll come to a time soon where we can turn around and talk about this as a part of history and move forward and just really help the kids to grow. But we miss everybody and we would love to see everybody again. So hopefully soon.
Thanks. And Kelly, I just want to thank you and the YMCA and, certainly all of the early learning providers across the county. I would echo that, Maggie. I think, I have an 8-year-old myself and trying to navigate working full time and homeschooling kiddos through technology can be a real challenge. And so, I just encourage families to really focus on that social emotional stability for your child right now, making sure they stay connected, feel loved, feel active. And, we're all doing the best we can right now. But I know the Y has played a huge role in serving our most vulnerable kids in the community. And so thank you for your efforts. I know the decisions that you've had to make through all this have not been taken lightly, certainly. So I thank you both for your time, and Maggie for your advocacy, and Kelly for your passion to help our local children. Thank you for your time.
All right, thank you.
Thank you.